this Wellness Wednesday, we're talking about a condition almost everyone has or have had at some point in our lives. It might feel like indigestion, burning, stomach pain after eating, or heartburn. That's right, I'm talking about acid reflux, but there are ways to combat this issue. And we're delighted to have with us Dr. Terry Pinson with Surgery Clinic of Tupelo, as well as North Mississippi Health Services, to share with us some more information. How are you, Dr. Pinson?
Very well, very well. Thank you for having us.
And thank you, as always, for joining us. So tell us, what is acid reflux?
Acid reflux is when the gastric contents or the contents in the stomach reflux back into the esophagus. The esophagus is a swallowing tube, and it begins at the back of our mouth, goes down through our chest, down through the diaphragm, the muscle that separates the chest from the abdomen, and then the stomach is formed. The lining in the esophagus is just like the lining in your mouth. You take Tabasco sauce, you put it in your mouth, it burns it, right? Well, the acid content in the stomach is actually stronger than that Tabasco sauce, so when it refluxes back, it burns. And so that's really what acid reflux is, and heartburn, things of that nature.
Now, when it comes to acid reflux, of course, a lot of people can get that confused with chest pain because it somewhat mimics it. Could you explain that?
Yes, I mean, because the esophagus goes down through the chest, if that's irritated and you're having spasms, you can have chest pain, and it can mimic heart or patients with heart disease or cardiac disease. And certainly that's why we work that up to try to delineate the difference between cardiac chest pain and GI chest pain. And so we work with our gastroenterologist to differentiate that along with our cardiologist.
Now, you are actually a surgeon, so you are the next point after a person sees a gastroenterologist. At what point does it become, I would say, a problem that I would have to go see you?
Absolutely. So most patients are treated with medications. Most of the medications are protein pump inhibitors such as Prilosec, Nexium, things of that nature will resolve the acid reflux symptoms. They actually, what that does is decrease the acid production in the stomach. It really doesn't stop the reflux, but it stops that acid production of the burning. And most patients will be able to be treated from that process. Where they start coming to us is patients that don't have relief of their symptomatology. They have persistent symptoms despite the medications, or they have an erosive esophagitis. Their lining in the esophagus erodes and they may have bleeding issues associated with that, or the lining may change to a different process such as Barrett's esophagitis, where that could turn into cancer down the road. Or they have a large hiatal hernia that is causing problems that can cause chest pain, gastritis, things of that nature. Those would be indications for an operation for reflux.
Okay, and when it comes to treating, and of course we're running out of time here, what do you recommend?
Well, we start with medications and work up through the gastroenterologist, and then we have an operation that actually stops it. We use the most advanced techniques here. We use robotic-assisted laparoscopy, so it's a minimally invasive approach to fix the hiatal hernia and reconstruct that valvular mechanism to allow patients to swallow, but keeping the gastric contents from going back up. Generally, we do the operation, let them stay in the hospital overnight. If they're doing well, we let them go home the next day. Wow,
so that's always good to know when you can be able to have that done quickly and then go home the next day. All right then, well, thank you so much, Dr. Pinson, for joining us this afternoon.
Well, thank you for having us.